If you're a senior citizen and thinking about Medicare, it can be overwhelming. There's so much to know and many options for coverage, and you want to be certain to have the correct plan for you. Stay tuned to the end because I'm going to review all 4 Medicare plan options for you so you can make the best health care decisions for your needs. Hi, I'm Jim Costa. I'm a videography, photography, and technology guru, and I created this blog to help you to become a tech-savvy senior. My tips and advice are useful to anyone, but my specific focus is in helping seniors to become more familiar with technology to improve and better their lives. If you have a question, leave a comment below. I do read all the comments that people leave, and yes, I do personally respond to each and every one of them as well. I've created many other videos on improving your technology skills, and I'll link to those in the description below and both during and at the end of this video, so stay tuned. If you want to learn more, remember to subscribe to my channel and hit that bell to be notified when I upload new videos. I upload every week, and I'll be uploading many more explanations of film, video, photo, editing, and tech topics that seniors can use because I am a full-time working photographer, video producer, editor, and technology pro. That's the small business that I own, and it's how I make a living. You'll find my contact info in the description below. Contact me if you need photography or video production services for you personally or for your business. Stay tuned to the end to find out how to get my absolutely free Medicare Options cheat sheet that'll give you all the information you need to get the right Medicare plan for you. Think of Medicare as a buffet. You'll want to choose from it the options that you can afford and that will meet your particular needs. First, you have to decide whether to go with an original Medicare plan or a Medicare Advantage plan. If you select to go with an original Medicare plan, your buffet will include Parts A and B and probably Part D as well. If you decide to go with Part C, which is a Medicare Advantage plan, it will be more like a sit-down meal, since a private insurer bundles together Parts A and B and most likely Part D into one comprehensive plan. Here are the 4 basic parts of Medicare that will cover you for everything from hospital care to doctor's visits to prescription drugs and more. First is Part A, which is hospital coverage. When you apply for Medicare, you will automatically be enrolled in Part A. It covers hospital stays, hospice care, and some skilled nursing care that you may need after being hospitalized for a stroke or a broken hip or other episodes that require rehabilitation in a nursing home or other facility so you can get back on your feet. Most people don't have to pay a premium for Part A. You've already paid into the system in the form of Medicare tax deductions on your paycheck throughout your working life. However, Part A isn't totally free. Medicare charges a hefty deductible each time you are admitted to the hospital. It changes every year, but for the year 2019, it's $1,364 US. You can buy a supplemental or Medigap policy to cover that deductible and some out-of-pocket costs for the other parts of Medicare. Medicare pays for virtually all hospital services for the first 60 days that you're in the hospital. There are some exceptions. It won't pay for a private room, for example. If you are a U.S. citizen or a permanent resident and have not worked long enough to qualify for Medicare, you may be able to buy into the program by paying a Part A premium. Next is Part B, doctors and outpatient services. This part of Medicare is the part that covers doctor visits, lab tests, diagnostic screenings, medical equipment, ambulance transportation, and other outpatient services. Unlike Part A, Part B involves more costs, and you may want to defer signing up for Part B if you're still working and have insurance through your job or are covered by your spouse's health plan. But if you don't have insurance and don't sign up for Part B when you first enroll in Medicare, you'll likely pay a higher monthly premium for as long as you're in the program. The federal government sets the Part B monthly premium, which is currently, at the time of this video's creation, set at $135.50 US dollars for the year 2019. It may be higher if your income is more than $85,000 a year, and is subject to change from year to year, so you'll want to check the current premium pricing when it's your time to sign up. Also, you'll be subject to an annual deductible set at $185 this year, and you'll have to pay 20% of the bills for doctor visits and other outpatient services. If you're collecting Social Security, the monthly premium will be deducted from your monthly benefit. Next is Part C, which is a Medicare Advantage plan. If you decide on a Medicare Advantage or MA plan, you'll still have to enroll in Parts A and B and pay the Part B premium. Then, in addition, you will have to choose a Medicare Advantage plan and sign up with a private insurer. The federal government requires these plans to cover everything that original Medicare covers, and some plans pay for services that original Medicare does not, including dental and vision care. In addition, in recent years, the Centers for Medicare and Medicaid Services, which sets the rules for Medicare, has allowed Medicare Advantage plans to cover such extras as wheelchair ramps and shower grips for your home, meal delivery and transportation to and from doctor's offices, for example, as well as other things. Most Medicare Advantage plans also fold in prescription drug coverage. Not all of these plans cover the same extra benefits, so make sure to read the plan descriptions carefully. Medicare Advantage plans generally are either health maintenance organizations, HMOs, or preferred provider organizations, PPOs. In HMOs, you typically choose a primary care doctor who will then direct your care and usually will have to give you a referral to see a specialist. PPOs have networks of doctors that you can see in the facilities that you can use, often without the need of a referral. If you go to a provider who is not in the plan's network, you will likely pay more. Part D is prescription drugs. This is the part of Medicare that pays for some of your prescription drugs. You buy a Part D plan through a private insurer. Each generally has some premiums and other out-of-pocket costs, either flat copays for each medication or a percentage of the prescription costs. They may also have an annual deductible. If you have really high prescription drug bills, you may be subject to the Medicare coverage gap, commonly known as the donut hole. Once you and your drug plan have incurred a certain amount of expense for your drugs, you'll have to pay no more than 25% of the cost of brand name prescription drugs and 37% of the price of generic drugs. For 2019, that amount was $3,820 US dollars. In 2020, the donut hole will be no more, and you'll pay no more than 25% of the cost of both brand name and generic prescriptions. If your drug costs continue to mount, you may reach the point of qualifying for catastrophic coverage. In 2019, if you have paid $5,100 in medicine costs, just your costs, not what Part D insurance plan has paid, you'll be responsible for 5% of the cost for each of your drugs. Be sure to check at Medicare.gov whether the plan you're considering has the medicines you take on their covered lists. These are called formularies. Those lists change from year to year, so it's important to recheck your plan every year at open enrollment. For 2019, the open enrollment period is between October 15th and December 7th. Now, these dates vary from year to year, so you'll want to check the specific dates from one year to the next when you are enrolled yourself. However, the open enrollment period is generally sometime between October and December of each year. Making your decision. Now that you know the parts that make up Medicare, you're ready to contemplate your big Medicare decision. Choosing between the two options for getting your medical coverage, a Medicare Advantage plan or an original Medicare plan. Here's a quick look at the differences between these two options. Under Original Medicare, you won't need referrals to see specialists, and you would be covered through the United States, anywhere you go. The federal government sets the premiums. You would need to sign up separately for several plans to be covered for all your medical needs. You'd want to consider a Part D plan for your prescription drugs and a Medigap plan to help cover your out-of-pocket costs, such as hospital deductibles and the 20% co-insurance for doctor visits or other outpatient services. Medicare Advantage Plans provide a one-stop coverage option and may also offer some of those extra benefits that I mentioned earlier. Such plans also typically have lower out-of-pocket costs than original Medicare plans and have an annual cap on out-of-pocket costs, which original Medicare does not have. Also, under a Medicare Advantage plan, you'd be dealing with a private insurer and have to select doctors within their network. So if, for example, you live in two places during the year, say for the winter you go to a warm location, and then the summer you live up north, you may not be covered in whatever place is not your primary residence, so you have to consider carefully the plans. Now, if all this is making sense to you, a tech-savvy senior in the comment section below. Do you have a question about Medicare? If you do, leave a comment below and I'll try to answer it. Would you like to learn more about your Medicare options? If so, I've created several absolutely free cheat sheets for you with all the information that you're going to need. The link to get those cheat sheets is just below in the video description. Do you want to see more videos like this? Follow my YouTube channel, Jim Costa Films, for more. Think what you saw was great? Like it. Do you have an opinion? Comment below. You know someone who could benefit from the information I provided? Please share the video. Do you want to learn even more? If so, then connect with Jim Costa Films on social media and online, on Facebook, Instagram, Twitter, YouTube, and the web. I currently have over 4,300 videos on my YouTube channel, Jim Costa Films, so feel free to check out many of my other videos for great tips and suggestions. If you follow me for a while, you may know that I have a community of technophiles, just like you, on Facebook, where I share pro tips and tricks. It's called Video Producers and Content Creators. I love new members who join and want to share their knowledge and information with their community. You'll find a link to that group in the description below. So feel free to join the group where you'll learn even more.